All right, welcome to a PSL demo day. I'm Jason DeBacher, president of PSL Foundation and associate professor of economics at the University of South Carolina. Today we have with us Erin Dalton. Erin is director of the Department of Human Services, of Allegheny County, Pennsylvania, and Erin is a leader in pushing local governments forward in terms of transparency and using data science to inform the public. Allegheny County has some amazing tools that are available on the web, and she's going to talk about some of those and her efforts in this domain. Erin, so good to have you.
Hi, thanks for having me. Glad to be here. Appreciate it. Go ahead and just jump right in and show you guys some stuff. Does that sound okay?
Sounds great, yeah.
Okay.
And again, clarifying questions during the talk, and then we'll have some Q&A towards the end.
Perfect. Please feel free. Yeah, I've presented here a bit of a kind of scattering of the stuff that we do. Obviously, a lot of the stuff we do is intended for our workforce internally, but definitely a lot of emphasis on being, kind of transparent, good government, important to us for sure. All right, let's see if my slides will advance. Of course, they will not advance. Hold on, let me stop sharing for a second. All right, see, that's when we test that stuff, and then all right, you can see my screen again, right? Okay, thank you. And I'll try and put it in slideshow. All right, yeah, I think when you let it go for too long, it gets stuck. Just a little bit about, Pittsburgh, Allegheny County and what we do. We're a county of about 1.2 million people. The city of Pittsburgh's 320,000 or so. And we have funding, a lot of state funding, federal funding, very little local funding, actually. Integrated health, sort of health and human services department, if you think about it that way, although there is a separate health department. So, but we do all of the behavioral health. And then we do invest in analysts, right? So we have at any given time about 40, sometimes more, analysts who work here and really support county efforts more broadly. So these are the ways that I kind of tend to think about the way we use data. And I always start with how we use it to coordinate care and give people back their records, kind of on the individual level. We are an operational agency doing, child protection and mental health services and homeless services. And so that we've got to get that part as right as we know how to. I will touch on some of the way we use data for worker decision making, and then I'll do a little bit on some of our public tools, kind of the management decision making, community use, open data type stuff. Just, for level setting, I always do share kind of the view of our really amazingly integrated data. So we're very fortunate. It's lots of hard work to bring together these data across the county and across kind of domains. So I won't read this to you, but we have a considerable amount of child and basic needs and physical and behavioral health, juvenile and criminal justice, vital records, and a whole bunch of other kind of prevention services and so on. So we try to bring that to bear when doing our work. And just to show you a bit about the way we integrate care at the person level and the tools we've had to do that. So we've been building this data for some 25 years. And the first tool that we set out to build was really to integrate care at the person level. And the idea really was to give data back to the people who we're serving, because who better than you to access your own records, coordinate your own care. It's common today in kind of health records. You access your own health records, but think of this 25 years ago, just trying to build that infrastructure. And then it was also very important to us to provide that kind of information to our staff and to other providers, nonprofits who are on the front lines of service provision. And so I'll just show you, this is a kind of redesigned view of something we've had in place for as I said, 15, 20 years. We call it Access My Info. These days, this is the view that the public would use to access their individual records. So we have very real ways of getting on the application, various access codes, and we if we're working with people, we provide them an access code, and then there's other ways of authenticating, because we obviously take that kind of security seriously. But then we give people, we give people their records. This actually is an older picture, but it makes the same point. You can have a timeline view of your history. So this is a view from one of an application that we use for our own staff. So we use better kind of wording and stuff like that. So CYF parent, those are data terms that, aren't helpful to the public, but so in the public view, it would say child welfare and so on. So, but what you can see here is like an incredible, like we have data back from the early 2000s, 2002, most typically, and all the way forward, to today. And you can look across people's kind of service experiences and help them to connect with people that they've worked with in the past, help them to make sure that they have all the benefits that they need. And when you're talking about things like child protection and so on, really try to understand the service experiences. So like those blue dots at the top, those happen to be births of children for a 34-year-old female. And you can see, considerable history across various service systems. So, and as I said, this is like a view that has been in place for some, 15, 20 years. And then you can dig into that data, right? You can look at all records. You can look at, if you can see on the screenshot, the caseworkers, the services that are associated with it. And you can update your own info in this tool too. So I don't know a better way to be transparent with the public. I can't think of a better way than to show them exactly what we have, right? These are the records we have. Their assessments and service plans are in here too. We continue to build this application, but we're clearly being transparent about what we think we're providing to people, and what people are billing us for in terms of their service provision. So that's a very quick look at that kind of client view tool or access my info tool that has different uses depending whether you're a client or a provider or somebody providing that kind of direct services. But super critical to the way we do our work here. And so let me just share a little bit about Allegheny County Analytics. So you guys can go on this, right now. This is where we host all kinds of things. So data tools, but also our reports, dashboards, policy documents, things like that. So, and we've been keeping this up for some, 15 or so years as well. So there's all kinds of reports, and that is certainly a way we attempt to be transparent with the public. My view is that if we've spent our resources on it, if we're doing an analysis, and it's sort of good enough for us to be using to make decisions, we should publish it. And so part of the way we've made that happen over the years is having a bunch of analysts, but also trying to solve the last mile problem of having editors and people to kind of take it from the analysis that's been done that was kind of good enough for internal work, doing sort of that writing work and that editorial work. So that's a bit about this website. I'm going to show you, you can see on the right, there's a whole bunch of things, right? So there's tools for analysts, there's tools for our providers, there's internal dashboards, but I'm going to show you Quick Count. That's the one that's on the top. It's the kind of most interactive tool that we have for the public, and it's really robust. So I encourage you to take a look. And it's like not that easy, I feel like, to design something that has all of this integrated data that is like easy enough to use. So you can give us feedback too on how easy it is to use. So just as an example, I have my screen blocking that. This is just a screenshot from the tool. It looks like we're pulling data from calendar year 2018. You can pull fiscal years, you can pull in kind of state fiscal years and so on. And then what you can do here is you can choose one program and take a look at what's going on in, say, different parts of the criminal juvenile justice system, or you can see on the screen here if you wanted to look at Medicaid paid emergency visits or something like that. Or you can do kind of cross tabs. And so that's what this is showing here. This is a look at, in calendar year 2018, people active in the Allegheny County Jail, and then whoever received publicly funded mental health services. And you can kind of get a count there, look at the look at those results. So, and we help people, like if you click through these things, we help people, we like write out the words of what this actually says, because people get this stuff, they interpret it wrong. It's easy to interpret it wrong. I mean, so, in order to interpret this, you would have to say, take the yellow, right? The people participating in both programs at 9,000, and say, divide it by the number of people in the jail, that 13,000, and say, okay, this is the percent of people who've had mental health services in the past that are active in the jail in 2018. You can see that you can look at this by gender, by age, by race. You can look at it by various geographies and political districts. So 2 are chosen here, neighborhoods and so on. So, and then even within that, you can then go look at the diagnoses. So if we were looking at this live, I could have taken screenshots, but we could show you which diagnoses people had on those mental health services, whether it's schizophrenia, depression, so on. So it's just like it's over years and years, it's become incredibly robust. And so that's obviously a tool that the public can use to look at what's going on in their community, look at, overlaps of various program areas, and do a lot of what we can do internally themselves. I wanted to also mention the Pittsburgh or the Western Pennsylvania Regional Data Center. This was like, part of that big open data movement, I don't know, 10 years ago or however long ago that kind of was reaching some of perhaps its peak. And I think good for the region, I think that we joined together. So there's not a separate city tool and a county tool. This is the infrastructure for all of Western Pennsylvania. I think the county has over 100, both the city and the county have over 100 data sets in here. This is another way that you can, download data, bring data together in one place. And I think, good on the region for partnering in this way. And University of Pittsburgh hosts the site. I also just wanted to mention, this is a new site for us. So we previously did this in a different platform. It doesn't really matter, but we try hard to get people to share their ideas with us in a number of different ways. Like we text clients, for example, and they can, share feedback. And we're testing various ways of using SMS to engage in other ways, but we also use this tool, which I don't remember. I think we're just calling it Engage Allegheny County or something. And then we used to use Neighborland. In any case, the point is we can put ideas out and get people to weigh in, and we do that. We do that on big kind of budget areas, and we do that on new policy approaches. So obviously has to be marketed, but I think is a helpful way to get feedback from some parts of our community. And I think we're okay on time. I've done about 15 minutes. I thought I should do something about predictive risk modeling. This is predictive risk modeling is helping us to make internal decisions. So it's not, it is definitely, in my view, more transparent than other ways of making decisions, particularly when, they are kind of gut decisions, when they're made with clinical decision making alone. But these are only public facing in the sense that we've published all of our documentation, which we have. So I'll talk a little bit about the way we've approached this. And there's probably lots of opinions about it, sort of one way or the other. So, my sort of view of the world is like government makes a ton of decisions, right? And I think the public should be very interested in the way government does that, period. Not that they should only be interested if they start using a tool or a predictive risk model, but they should always be interested in how the important decisions are being made, whether that's who gets housing services, who is subject to a child welfare investigation, or a number of other areas where the government's making really tough calls. In my kind of view of the world, this is the kind of typical progression. I will show you quickly a tool that we put in place to replace gut decision alone. But often there's rules, right? So the federal government sets up rules. They'll say, we want you to prioritize chronically homeless people who are, been on the street for longer than X as a proxy for something else that they want. They're trying to get a vulnerability there. It's not a very good way to get a vulnerability, but it's their way, right? And then you've got, a whole marketplace of surveys and needs assessments and other kind of actuarial tools. And then in some cases, the government's also using predictive risk modeling. And we've certainly set out to do that, but we set out, I think, to do so with care. Think back, we issued our solicitation around this back in 2014. 2014 was a long time ago, like in this world, for real, a long time ago. But I think we're thoughtful about it, sought partners that would also be thoughtful about it. And we've come to these things kind of over time. We don't model for the sake of it. Lots of governments do that, right? They just want to show they know how, like some analysts in the agency want to show they can do modeling. Like, all right. But like, if you're not going to use that, what's it for? We don't just, I don't know, run amok with models. We're trying to solve real problems. And so kind of commitment to implement's really been important to us. Competitive procurement, built in the public domain, period, hard stop, everything's available. The partners we selected to work on the first work we did here suggested in their proposal an ethical review. We hadn't thought of that. We love that. We've continued to do those. As this has become more available, we've been funding separate and independent model fairness and discrimination reviews. We validate with data outside of the agency. And then we do a whole lot of stakeholder and community engagement, which is not so easy to do. But we do that. We do it in a number of different ways, including standing in front of rooms with 100 people in them, willing to talk about it. Transparency, so you can go on our website and see all the documentation for our models, evaluation commitment to continue to improve for sure. So I think we're okay. I'll just run you through very quickly the kind of thinking behind the tool that we put in place first, and that is probably most controversial. In child protection, the agencies around the country get a lot of calls. Like they just do, 14, 16, some jurisdictions, 30,000 calls a year. It is typical that agencies go out on about half. It is not like the police or 911. Agencies do not respond to every call. The question is, which half do you go out on? Child welfare agencies want to make sure that kids are at least seen to make sure that they're protected. And the way that these decisions are being made in other jurisdictions are exactly what you'd think. Sometimes we're just like taking the call or getting the report of the allegation and making a decision. That's what we were doing in Allegheny County. They had access to data to take a look and see what was going on with the family, but there was no actuarial tool, no assessment of sorts. Lots of jurisdictions are using assessments, and we sought out in 2015 or so to look at whether a data-driven model, predictive risk modeling, could help. And we partnered with a group led by a woman out of New Zealand who won the solicitation for that work. So I'm not going to go into a technical discussion here. Like, we built a model, right? And we were predicting the likelihood of a future adverse event. So future meaning over a long arc risk. So a safety issue so significant that the child would have to be removed from home, for example, within 2 years of that index call. And we built a score from 1 to 20, with a 1 being the bottom 5% of risk and a 20 being the top 5% of risk. And then when you look at those ones, I'll just give you the kind of business case here, the use case for this. When you look at those ones, that bottom 5% of risk, about 1 in 100 of them experienced a home removal within 2 years of the call. And then when you look at those 20s, about half experienced a removal. So that's a judge, and there's lawyers on both sides. It's not something we can just do on our own. And all that tells you is what we know is that there's variation in the calls that we get, wide variation in the calls. But what we found in the research was that over a quarter of those highest risk cases were being screened out and not investigated, right? So an investigation is just us. It's important and it's serious, but it is just us going to take a look. In fewer than a quarter of those cases, even where we go and take a look, do we open a child welfare case? Even fewer do we file a court petition, and about 3% of those we end up having a removal. So, but it is our job when an allegation comes in to to see if we should go take a look and make sure kids are safe, right? So those highest risk, those 20s, we were screening out about a quarter of them, and lots of opportunity on the lower end too. Half of the lowest risk cases were being screened in. These are cases that don't need our attention or likely don't need our attention. Though the people doing the work, the clinicians, do still get to make that call. If the allegation is very serious, we're of course going to go out on that case. It doesn't matter what the risk score is. Anyway, Stanford did an impact evaluation. Results are here. You know, we saw no big surprise, increase in identification of kids in need, reduction in disparities of case open rates between Black and white children. And then we didn't see, interestingly enough, and we're still not seeing sufficient screening consistency. It's something to take a look at for us. So anyway, is this better than gut? I think so. But there's lots and lots that have been written about this, like, you know, whole chapters of books on sort of both sides of the work. And in part, people can write about us and do because we share the data. Like, it's up on the web, so there's a lot of access to the information. And the weights are not on the web because we want to know who has them, and we want to work with the researchers or others who are requesting them, but we always provide them, including to the ACLU who requested them and so on. So, but there's lots of discussion about this in the field, and I think this stuff likely gets decided in Allegheny County. Kind of helps to get decided how this stuff works for the country, actually. So we're very much in play right now. With this tool in particular, we've implemented other tools in homeless services that have been incredibly useful in reducing bias, in particular there. Anyway, so lots to say about that stuff. And then there's obviously so much more to do, like some basic stuff that we haven't done a very good job of here. Like, I don't know, our money systems and our contract systems are convoluted, but as soon as I get them straightened out, we'll publish all of that. Like, and so everyone, you know, there is stuff on the web, but there could be way more. We could be doing better and sharing code. I'll leave it at that. I have lots of pontification I could do, but I'll leave it at that, and information is here. So I'm gonna stop sharing if it's okay. I haven't looked at the chat, so we'll do that as we go.
Well, Erin, thank you, and that's a perfect place to leave it, I think, for our audience who's especially interested in kind of open source modeling and that transparency. So if I take the moderator's prerogative here and ask the first question or set of questions, you know, what has you noted, you know, everything's open so you can get that pushback. What are some of those trade-offs that you all thought about when, you know, open sourcing the code to these risk assessment models, and then the choice of not publishing those weights in the public domain? What were the things you were thinking about in that? And following that, what have you kind of thought ex post after you've done this? Has it been a worthwhile trade-off to release those code and make that model transparent? Oh, you're muted.
Yeah, it was early days, and I think we are still learning. I think we thought about this, obviously. We could have given the weights. We worried about a couple of things. One, we did want to know who was accessing it. Like, we wanted it was always available upon request, like it says that on the web, and we got plenty of requests, and we provided it. We also so we wanted to know who was accessing it. We worried about people just thinking they could take them in their community and implement them, even though that doesn't make any sense. Like, I don't think that would get that far, but thinking that could. And then the other thing I really did worry about is, if you know this stuff at all, you know that any individual variable here is actually not that important. So what I was afraid of, in part, was that people would see that, oh, mental health services are weighted heavily here, or, you know, emergency room visits are weighted heavily here. I'm not going to go to the emergency room, right? And then I could take the entire emergency room database out of the model and still have the same accuracy. And so we did actually worry about how people, and particularly how other people, might use this information to tell people they shouldn't access services, that very much need people to access. And so those were some of the considerations. But it wasn't because it was like proprietary and anyone wanted to sell it. It wasn't for any of the reasons like that. It was more trying to take care in the implementation of this work. But I do think we should release the code at this point. So I do. I think the world has changed a lot. There's a million things already been written about Allegheny. Like, so if people think that, then they think that. And so at this point, I think releasing the full code makes sense.
Right, and Rick has a few questions. Rick.
I'm trying to.
All right. I probably asked too many in the chat. I was just kind of recording these as you were going through. But I mean, it looks like you have a ton of data, great interface. Kind of want to get a feel for where Allegheny County stands with regard to the rest of the country. Like, were there any other cities that you guys patterned what you were doing after, or are you the leader in kind of this type of a public facing interface?
Yeah, there are other models for sure. And we look to, places like Montgomery County, Maryland, that does interesting work, and New York City does interesting work. And then like, even states like the state of South Carolina has this really interesting, like not public facing, but really interesting integrated data. And the folks at the University of Pennsylvania and the Actionable Intelligence for Social Policy Network, they've been trying to push this kind of data sharing forward through their network. And so we learned from them as well. In terms of like making policy decisions to integrate at scale and make it available, I think we're probably amongst the leaders there. And there's, as I said, much more to do. We'll keep going. So I think we might.
And did you guys have any? You said all the models you were using were in the public domain. Do you have any central location or repository where those reside, or are they just kind of all over with your outside contractors?
Neither of those things, though I do think we should again start to publish them in the more like GitHub type domains that exist. No, but they are on Allegheny County Analytics. So you have to like go into the reports and stuff like that. So they're attached to the subject matter as opposed to being a set of places for models. We wanted people to understand the issue. So I think our aim was different in how we published it. But as I mentioned, I think it's a good idea at this point to post them centrally. Yeah. What else was there? I see there's a data privacy question, as there should be. Yeah, and
yeah. So I asked at the end if you got any pushback from data privacy folks.
I mean, sure, of course, at various times in the infrastructure. I mean, the thing, there's a couple and I could point you to where we kind of talk about our policy decisions here. People are consenting when they're going to the provider that they're going to, and they, you're consenting to share that information with the payer. The thing that we've chosen to do, taking the policy legal approach here, is to redisclose at scale, because if we waited for people to connect to one another, or there to be an active consent, you would really lose all the opportunity to help people. I think there might have been more. I mean, let me just say that the reason why this whole thing gets built is, I wasn't there at the time, was that the director was asked, like, we're tired of telling our story 100 times to different people. Like, why don't you know what's going on with me? Like, why are you asking me this again? And so it really did come from people. And because people have access to their own records, I think that's really changed everything. If we weren't willing to do that, then I think people would potentially have a much bigger issue. But the benefit that can be gained from actually coordinating care, it would seem from Allegheny County, feels like it outweighs the negative. We don't get complaints, which is sort of just a remarkable thing. I mean, we do a lot of work, obviously, to make sure it's not misused. So that's a whole nother kind of set of work that we do, but it's critically important that you do that. And lots of
Kevin.
researchers use our data. Yes, yes.
Hi there. Ooh, can you hear me now? Cool.
Yep. You're good.
Awesome. Thank you for this. This is so awesome. I've got my Penn State fly fishing hat on in honor of this talk today. And I just wanted to ask a quick question about what you'd said earlier about the last mile problem that you were encountering and getting this out, a lot of the things out. I mean, it seems like you have already put a ton out, and is it primarily on the code side that's the problem with like getting these repos set up and getting code reviews done or documentation for the models written, and what kind of editorial like kind of hurdles are you finding in getting this all out that you're struggling with is what I'm curious to hear about more about.
Yeah, it's interesting. So it's not my background. You do what you like know how to do and you're like sort of feel like you can do. And maybe it was more like when I went to school and whatever was available. So as I said, I don't think we've done that good of a job on the kind of sharing code repo side, which we could really do. Like we're writing, I mean, our analysts are writing in R and Python, and they can be sharing more of that. And we have a new, as I became the director of the agency, there's a new lead for that work, and I think he'll be able to take that a bunch further. So the last mile problem that I was referring to was like writing for the public, like writing for people, like writing for, and it's really not, like, I should be clear, it's really not writing for clients so much, though obviously clients can have access to it, but it's like journalists and researchers and public policy people and like advocates who would want to say like, oh my God, you just told us this horrible thing about whatever, because that's not that hard to do in our work. We should get better at that, or we should design a service that helps to. So that was what I prioritized, was writing for that population as opposed to the kind of broad analytic community. But that community is important too. So there are probably last mile problems in both, though, I'm sure. And I think if you don't solve that, people, these these analysts are good and they have their work is important to them. And so they're not going to put out their drafts, but they should. Like, you know what I mean? And so, and we don't want them to put out their drafts. So we should give them the extra, and it's a weird problem to solve, but I think it makes a big difference and isn't so expensive to solve, really. I hope.
Yeah, Erin, in that regard, I mean, it seems like a large staff of analysts relative to what I would have expected with a county government. One, I guess, how have you been able to build up that staff? And then number two, how do you have opportunities for researchers or others to collaborate with your work?
Yep. Yeah. It is weird. Like if you think about government and like what they spend on IT and how little they're willing to spend on like the using of information, it's just wild. Like people think, there are of course people in government who think that, any dollar not spent on services is a dollar misspent or something. Though I think we could argue for sure that we've made that better. But think of what they spend on IT. Like if you just took 1% of budget in any government agency, it'd really be way, way more than what they're spending right now. So we take the approach that it's important, and it's so critical to like the work of this agency and any agency, as you would imagine. It's just unbelievable. And how, I mean, we're lucky, like we sit in Pittsburgh with Carnegie Mellon and University of Pittsburgh and Duquesne and other, Penn State, other fantastic schools in the region who are just regularly churn out amazing people, and they come here. Like we got 90 applications for a data science job recently, and this and it is because the work here is really worth doing. And yes, there's lots of opportunity. So there's links on our website to requesting data, but I can put Alex's information in the chat too. Alex Jucka's the new lead. You guys can reach out to me as well, but the new lead for that whole analytics area. I think there's lots of opportunity to partner and and maybe even take some of the code, like take all of our draft code and maybe solve the last mile problem with a group of people that work with you guys.
All right, well, Erin, thank you so much. This has been wonderful. I'm really impressed with the work you and your colleagues in Allegheny County are doing, and it's really good to see this application of transparency and data science make such an impact on the community. So thanks a lot.
Thank you. Thanks for having me. Take care.
Take care, Erin. Bye-bye.
Bye.